Ladies and gentlemen, my commendations to the team from Partners Heart and Health and the Medical Associates Hospital on the organization of the training summit on the world's leading cause of disability and the second leading cause of death, stroke. Stroke, as most of us may be aware, is also a leader in economic impact, representing one of the world's largest economic burdens. Estimates put the tab at some $891 billion each year. This is on top of the emotional toll to the individuals affected and to their family members. That we are in need of enhanced survival to safeguard optimal patient outcome is impatient of debate, and we must figure out how to get there successfully together. I am therefore pleased to join the team of presenters to help to lend needed insight into the realities as they are in Jamaica and to engage in this knowledge and experience sharing and building in order to put our health teams in the best position to enable the best possible health outcomes for those affected by stroke. Jamaica's stroke burden, as an indicator, speaking at a World Health Assembly side event earlier this year, death ranking provides a clear picture of a country's disease burden, and it is on that data that I rely to provide the insights on the stroke burden in Jamaica. Between 2010 and 2020, stroke was among the top 6 leading causes of death, behind breast cancer 63%, heart disease 62%, hypertensive disease 57%, diabetes 37%, and prostate cancer 25%. Stroke accounted for 20% of deaths over the period. Of note is that also between 2010 and 2020, the leading cause of death for males was stroke. For female, it was diabetes. Also, in 2017, some 22,599 persons with hypertension had stroke as a complication, 12,100 of them males and 10,400 of them females approximately. Risk factors for stroke among adults in Jamaica are primarily hypertension and diabetes, heart disease, while in young people, the risk factors include sickle cell disease, schematic lupus, abnormal blood vessels they are born with, and heart disease. There are a number of challenges to stroke care in Jamaica, from access to care, including readily available imaging, to insufficient coordination of intervention, and limited post-stroke rehabilitative services in primary care. Access to timely and quality health care, early effective intervention requires timely imaging, intervention by specialists. Each of these parts is challenged at this time, and a coordinated approach is also affected. Stroke affects persons across the country. The most equipped facilities, our Type A University Hospital, is now geographically accessible to many, though it is located in the most populated part of the country. Post-stroke rehabilitation services require sufficient physiotherapy services, both inpatient and outpatient. Whereas we do have a National Rehabilitation Center, the Sir John Golding Rehabilitation Center, and physiotherapy services in our hospitals, the physiotherapy services in primary care, which would offer continued follow-up care, are in the embryonic stages. Jamaica's plan to improve access to care is captured in the 10-year National Strategic and Action Plan for NCDs, which provides an overall roadmap for NCDs pursuant to that plan. Jamaica is increasing capacity for diagnostic radiology equipment imaging in our hospitals, including our CT scans, MRIs, through a leasing arrangement and placing such equipment access across the country. Training relevant specialists to have them placed across the country so that we can work in teams, thus increasing access geographically and technologically. Radiologists, internalists, neurologists, neurosurgeons, radiographers, and cardiologists. We also recently announced scholarships for healthcare workers, which is to see more doctors, nurses, and allied healthcare professionals available for the supportive roles needed in this and other areas. In addition, Jamaica is pursuing primary care renewal as a key and primary component of care, which is to see physiotherapy services instituted in primary care facilities. The plans and microplans for this have been written and are being implemented in phases. Persons will therefore have access to rehabilitative care in the community with the intent to increase functionality and quality of life through increased independence and mobility. Importantly, we are supporting these interventions with the prioritization of awareness and education. Many strokes, we know, can be prevented if people recognize the risk factors and early signs. Public health campaigns must therefore emphasize the importance of managing blood pressure, maintaining a healthy diet, exercising regularly, and avoiding smoking and excessive alcohol consumption. And we are doing that in Jamaica with the design and ongoing implementation of a number of campaign interventions, including Know Your Numbers and Jamaica Moves. But we still have a long way to go, yes. And I trust that these 3 days of training will help us along this journey, yielding the plans for and outcomes in the public health interests of all. My commendations to the organizers. Through the Ministry of Health and Wellness, we stand ready to collaborate for the public good. Stroke is indeed a going concern and a major health threat to Jamaicans. We have to do more. We are prepared to do more, and partnerships will get us there. Thank you very much.